Hey everybody, it's Dr. Tiffany Lamberton of TMD Collective, and this is another episode of Jaw Talk Podcast. You guys, I am just one day before my Women in Dentistry CE event this weekend here in Tacoma, Washington, and I am so excited to be welcoming women in dentistry from all over for our incredible CE event. If you have FOMO, stay tuned. We may be coming out with some recorded material from that. But today I am super excited to talk to someone who is an icon in cosmetic dentistry, Dr. Andi-Jean Miro. She is such a great dentist, and we really get into it in this conversation about her journey. So Dr. Andi earned her dental degree from New York University College of Dentistry. While she was there, she completed a one-year advanced clinical concentration in aesthetic dentistry. Dr. Andi went on to complete a prestigious one-year clinical residency in Brooklyn, New York. After that, she joined the prestigious APA Rosenthal group in NYC. Dr. Andi stays up to date by attending nearly 300 hours of continuing education courses a year. Dr. Andi is passionate about teaching and all things dental education. As co-founder of Strive, she hopes to bring high-quality dental education to the masses in an easy way. Dr. Andi was the recipient of the Rising Star Evie Award in 2017 from the American Academy of Cosmetic Dentistry and is a member ambassador for the organization. Dr. Andi currently holds several academic teaching positions. She's an assistant clinical professor at New York University College of Dentistry in the aesthetic dentistry department and a clinical instructor and lecturer at the Rosenthal Institute Hands-On Aesthetic Advantage continuing education program in New York. Let's dive right into this fabulous conversation. Hey everybody, this is Dr. Tiffany Lamberton of TMD Collective, and this is another fabulous episode of Jaw Talk. And you guys, I am so excited for my guest today. I've been badgering her on social media. Dr. Andi-Jean Miro, thank you so much for coming on to Jaw Talk. This is such an honor to get to talk to you and just share ideas about women in dentistry. Welcome to the show.
Thank you for having me. I'm so excited, and I'm so excited to close the week out talking to you because I feel like I have so much to talk about. So it's going to be a fun podcast for sure.
Yes, and I want to give a shout out to our fellow colleague, Dr. Eric Van Boning, who introduced the two of us. Him and I are part of this bougie study club, the Chicago Study Club. And so I started telling him, I'm going to be doing this Women in Dentistry event. And he was like, you have to meet Dr. Andi. And so just shout out to him. Kudos. I love it when people link good people with other good people. It's just wonderful to be able to talk with you. And I've been fangirling you on Instagram, and I can't wait to just dive into this. But let's talk about your cosmetic dental journey. How did you you went East Coast, now West Coast. Tell me a little bit about
all over. It's funny. I graduated from NYU in 2014, and being a dental student at NYU, you have a ton of exposure to dentists who come from all over the world to teach at NYU. And NYU sometimes gets good or a bad rep depending on who you're talking to. But my time at NYU was amazing. I got to meet so many amazing clinicians in my 4 years at NYU, and it opened my eyes to what is possible and all the things that are possible in dentistry. When I was going into dental school, my mom was like, you should be a pediatric dentist. And I was like, okay, maybe that's something I want to do. But then I remember my first first semester, drowning in schoolwork and not really understanding how to study, not really understanding the volume of information that I needed to retain in such a short period of time. And I was really struggling. And I remember going to one of the lectures, and it was a guest speaker, and it was Dr. Larry Rosenthal. And I never knew who Dr. Larry Rosenthal was, but this man got up on stage, and he was one of the most magnetic human beings I've ever met. And he started telling a story about his patients, his cosmetic patients. And I remember every slide he showed, I remember every word he said. I remember the videos that he played. And I just remember thinking, like, this guy understands a part of dentistry that is so different than I was used to at that point. And it really opened my eyes. And then I remember after he got just completely rushed with people, I reached out to him separately and just wrote him an email and said, I'm so obsessed with what you're teaching, like cosmetics. I never thought cosmetics would be for me. And it was that one lecture that really opened my eyes. And a year later, I remember meeting Dr. Michael APA, who at the time was just exploding in the cosmetic field. And he was going back and forth to Dubai and like all of these amazing things that this guy from upstate New York was doing. And again, I had that same emotion of this guy really gets it. And it wasn't until years later that I found out that they worked together. And I think from the first time I saw both of them, I knew that this was something that I wanted to do. Cosmetic dentistry was my goal so early on. And as I progressed through NYU, there was an honors in aesthetic dentistry program. And that was really unique and something that is very exclusive to NYU, where you have dentists coming once a week on Fridays to NYU, and the student to doctor ratio was absolutely different than your general clinic. It was like 2 instructors to 1 student. And so I was learning cosmetics in my 4th year that people didn't get to do in dental school. And so that really changed how I felt about dentistry. And it really shaped a lot of who I am today, to be honest with you. That's a very long-winded answer, but yeah, that was the intro to cosmetics.
And then you went on to actually work with Dr. Appa in New York.
So the interesting thing about this is people always ask me, like, how did you get into that practice? And so the story is funny. I knew that Dr. Rosenthal was throwing an event, and I was also throwing an event for the students for a student organization I was a part of. And I remember sending him an email. I'm like, I know you're hosting this event. We're also hosting an event. Why don't you come to my event to promote your event? And he did. And I remember him coming in and shaking my hand. And again, it's one of those moments I can close my eyes and see the entire interaction. And we were talking, and I was talking about how much I enjoyed dentistry and how I was a 3rd-year dental student and so excited to go into this honors program. And at the end of our conversation, he gave me his business card. And it's like your normal business card is like a square, right? And so he pulls out this like super slick, like long rectangle business card, and he hands it to me. And he goes, give me a call. I think you should come and see what we're doing in the office. And so I proceeded to call 37 times before I was allowed to come into the office. So anybody that says persistence doesn't pay off, it clearly is not persistent enough. And I remember coming in my first day, and I was in my 3rd year dental school. I didn't know what makeup was. I didn't know how to walk in high heels. I was just like this little girl with a dream of doing cosmetic dentistry. And the first day that I was there, they had a camera, and I was really good at taking photos. I'm really into photography, not only dental photography, but regular photography. And I remember Dr. Rosenthal was doing this case on this like princess, and he was having trouble taking a photo. And so I just take the camera out of his hand and I start taking pictures. He's like, you know how to do this? And I'm like, yeah, I do. And he's, oh my God, that's amazing. And so at the end of the day, and I always tell the story, and it's so funny to me because looking back on it, it's just something so little, but he tried to give me $100. And I was like, I don't want this money. I just want to learn. Just let me come back. And so I came back every Tuesday for the entirety of my dental school career. So all of third year, all of fourth year. And every Tuesday when I got into my residency, I would call out sick. I would go to the Upper East Side. I would shadow and I would be so excited. And I would come home on Tuesday nights and I would just bawl. I would be so upset because then I had to go to my residency the next day. And it was not the type of dentistry that I wanted to be a part of. And that to me, it was a hard time because I knew that the type of dentistry I wanted to do was in that office. And if we go back now, we're talking about 10 or 11 years ago, right? 10, 11 years ago, APA Aesthetic or APA Rosenthal at the time was one clinic in New York City. Dr. APA had been flying to Dubai and he had just opened Dubai. And so when I joined the clinic, I was the first associate they had in years. And I was the first female associate that they've ever had. And unfortunately, still the only female associate that we've ever had. And since that time, we've grown. Now we have LA, we have Miami that we just opened. Obviously New York and Dubai, we now have something like 13 associates that are just young and hungry and like just as excited about dentistry as I have been for all of this time. And it's really grown and it's been such an amazing journey, but it definitely, like, I always talk about how amazing it's been, but it's also been really freaking hard. Like, being the only woman in this organization is a tough thing. Being the only woman in any situation is a tough thing. And I always joke that my mom named me Andi because she knew I can hang out with the boys. Like, she named me a boy's name for a reason. And it's interesting because I always think about it when we're doing these like podcasts or looking back. Oh, okay, that's amazing. Like, we've done all this, but there's still so much that we're building and we're doing. And it gives me so much excitement to come to work every single day.
Talk to me about how did the LA part of it evolve and how did you like break into that celebrity status dentist, cosmetic dentist?
I hate being called a celebrity dentist. That is
You?
so
Okay,
I just want to be a normal person dentist because celebrities are normal human beings. And
yeah.
I think sometimes if you treat them like they're celebrities, that's different. But for me, I just try to tune that noise out sometimes and just focus on the person and making sure they're having a good experience. How did LA happen? This is a bit of a story. I'll try to abbreviate a little bit. But basically, I was working in New York for about 7.5 years. And I really wanted to run a clinic. I had been at the right hand of Dr. Appa for, at that point, 7.5 years. And I really wanted to be a bigger part of the brand. And we were about to open Miami. LA has been open now for about 5 years. We just celebrated our 5-year anniversary. And a funny story about that, when we were building LA, I came out in December, the year that we closed the contracts for this place. And I remember walking through this office that I'm currently working at and doing this podcast in. And I remember going around with the builder and then them saying, over here will be the lab, and over here will be the consult room, and this will be the office, and these will be the operatories. And so for so many years, I had envisioned, what would it be like to be in LA? What would it be like to be in one of these offsites, right? Because I was at the right hand of Dr. Appa for 7.5 years. That's like the most intense position to ever be in because he is a perfectionist. He's somebody that is super driven and he motivates everybody around him to be that way. And so it's high pressure, high reward as well. And I remember saying to Doc, I want to run Miami. And to save you a lot of the nonsense, he felt like I didn't fit in Miami. And I think it's so funny. I talk about this a lot because sometimes the people in your life know you better than you know yourself. And I'll explain. He said to me, I don't know if Miami's the right fit for you. Like, just stay consistent, keep pushing. We're going to figure it out. And I actually spent some time away from the practice. I taught a good portion of last year. I took some time to travel. And Dr. Appa basically came back to me and was like, I think it's time that you come back. And I have this idea for you. And basically, we sat for a couple of hours and we talked through a lot of different things. And he basically said to me, I think LA is where you belong. You are one of the strongest people I have, and you can go to LA with a team that is amazing and strong, and you can lead them the 3 weeks out of the month that I'm not there. And I came home and I thought about it for 2 days straight. I didn't talk to anybody for 2 days. I just was in my head about it. And I texted him, and basically he said to me, if you want to come back to New York, you can come back to New York. If you want to move to Miami, we have docs there, but I'll put you in Miami. Where I think you belong is LA. And I thought about it really hard. And my old assistant from New York, Val, is an assistant in LA. She asked to move here when we opened. The office manager here, Bridget, trained in New York 5 years ago. She's become one of my very good friends. The team here was so great. And I texted him, LA, sounds like a plan. Let's do it. And I think he was even shocked, to be honest with you, because in about 2 weeks, I packed one luggage. I left everything that I had in New York, my beautiful apartment, all of the things. I packed up my dogs and I moved to LA. And it's been the best decision that I've ever made because my life here has so much more balance. It is very fulfilling. I'm able to actually live and have a good, healthy work-life balance. And now I'm in this phase of my life where it's not just about me anymore. It's about my team, and it's about building the next generation of dentists in the APA brand to be great, because that's the only way that we're going to continue doing what we love. And it's been really great being out here. And the patients are very different. Until recently, I didn't know what microplastics were, but in LA, that's all we talk about. And I've been a dentist for 10 years, and I don't know that I've been asked so many plastic or material questions as I have been in the last 8 months. The patients are really educated. They want to know what's going on when you're treating them. And something as easy as, does this night guard have this plastic in it? And these are questions I didn't know until I moved out here. And so it definitely is giving me a reinvigorated type of feeling, because I'm learning a lot more as well being out here and meeting such amazing patients from all over the world, which is pretty cool.
I know one of my favorite stories, because we were down in LA for 10 years with like dental school. My husband did residency. And I remember being like so pregnant, like 8 months pregnant with like our oldest. And we went to the hot spot for brunch in LA, pull up in this nice car. I had my big Gucci sunglasses, my cute Prego outfit, and everyone looks up and then they like immediately look away. They're like, oh, you're nobody. I'm just like, how do they know? They just know like that. They're like, you're just nobody.
I don't think that's, it's so funny because I think when patients come in, I think I treat everybody like they're a billionaire. I give them the best treatment plan I know how to. And it's so funny because I think looks can be very deceiving in LA. I think sometimes people come in and they look like they maybe don't have a lot of money, but they're the first person to sign the treatment plan and get started. I think in LA, yeah, there's definitely places like that. I happen to live and work in Beverly Hills, which ironically is very similar to the Upper East Side in Manhattan, right? The same types of stores are there, the same types of people, but it's definitely different in LA. Very different from New York as well in terms of the culture as of the people. But I think it's really different. And I don't know why I'm so offended by this, but people are like, you like LA? And I'm like, maybe because I was just the ultimate New Yorker and I was just always so pro New York Rangers, Madison Square Garden, like all the big things. But I do really like being here. And I think I'm more at peace with myself. Like mentally, I feel really clear and I'm able to just do the best things that I know how to here, which is a different part of me. I wasn't like this in New York. I was a lot harder on myself. I was very angry. I didn't feel like I was the best version. I had a lot of anxiety, to be very honest with you. Like if you're doing this type of dentistry, it does create a lot of anxiety around patient treatment, patient results, all of those things that we know as dentists are so hard to hit the check mark on. When patients are paying an exuberant amount of money, they're going to expect the best of the best, and that creates a really high standard. And so I love being part of this team because I'm able to deliver those results that I know that I can for those patients. So it's been fun.
I've been dying to talk about Rachel Zoe. I know that she was a patient that you've just done. You did her smile makeover, and I would love to hear a little bit more about what that experience was like.
Let's dive into this, okay? I am 36 years old. So what does that mean? That means that I grew up watching the Rachel Zoe Project. I grew up saying major and all of the little Rachel-isms that made her who she is today, which is a badass female who is so pro-woman that when she came into the clinic and she met me, she basically said, I'm obsessed with you, which like, I'm obsessed. I'm obsessed with you and I can't wait to do this with you. And that is such a special thing because obviously patients can choose any dentist in the world, especially somebody like Rachel. Like she has the ability to go to any dentist, but she chose me to be the person that brings this vision to life for her. And so I definitely was a little nervous going into it, but I would say like she gave herself over to the process. She came up with a tagline for me and she's like, you can't have good style without having a good smile. And it's so true. So often I see people that are so put together, right? You put makeup on, you do your hair, you wear nice clothes. And then when they talk, their teeth are a mess. And so that was something that she was feeling like over time, her smile had just aged her. And as we age, we lose collagen, we lose elastin in our facial structure. And so most people will use fillers or different types of things to give back that volume. But one of the biggest things that you can do is you can change the position of the teeth. If we change the position to be in a more outward position, you're going to have more lip support. You're going to show more teeth when you're talking. And all of those things are super youthful. And so that's basically what we did for Rachel. We just hit the reset button. We did some really minimally invasive veneers because we were adding volume. And I'm telling you, from day one in the temporaries, I don't think she smiled for years because it was so hard for her to crack a smile because she hated the way her teeth looked. And I remember the first day when she was in temp, she came in and she just gave me a little like side smile. And I'm like, who are you? Like, this is insane. And so it was really special because she allowed us to share that journey. And I think one of the biggest things that I have difficulties with is I'm so about how much this changes you facially. And it's hard sometimes because it's a super private thing to get your teeth done, right? So I'm not the dentist that's going to ask you, can I share your full face before and after? Because I just think it's invasive. And so if a patient is doing it and they're tagging me, great. I'm going to ask them like, I'd love to share this with the world. Are you okay with it? But I will never pry for a patient to share this. She was so gung-ho about sharing the results. And people were reaching out to me left and right. Like, she looks like she had other work done. I didn't think it was the teeth. And that is the true sign of good dentistry is when it's seamless, when somebody comes up to you and says, you have a great smile, not you have great veneers. If they say you have great veneers, I've failed. That's not the answer that I want. I want them to say, you look so great. What have you been doing? And not be able to pick up on the fact that it was veneers. And it's so funny because Rachel has been out in the Hamptons this entire summer since I did her teeth. And all summer she's at these social events and she's smiling like she's never smiled before. And every time she gets a good picture back, she texts me and she's, you see these teeth? Do you see what you did? And she's my ultimate hype woman. Like, that's what you want. You want raving fans, right? You want people talking about how amazing you are because that's how people find out about you. And it's been a fun journey. I'm like the little girl in me. Every time she comes into the office, I'm just like, I can't believe this is my life. I can't believe that this is what I get to do.
Yeah.
Crazy.
Well, and I recall too that she'd had premolar and retractive ortho.
I know that.
I'm paying attention. I look at the jaw joint stuff. That's my jam. I'm looking at airway stuff and profile, and so
we should talk about that for a few minutes because that's such an important part of what I do. I get patients that are in there. I get a range of patients, but a lot of my patients are female. And a lot of my patients are anywhere in the age from 25 to in their 60s, right? And the interesting thing is a lot of my patients that come in that are in their 40s and 50s, they have bicuspid extractions. They are collapsed. They have some crowding. They have wear patterns on their teeth. They are constricted. These are all things that are a result of removing teeth and creating constriction in the airway. And so a lot of these patients, what I'm doing is I'm figuring out where they're comfortable in their bite. I'm opening up their vertical dimension to give them a better airway. And what I see is patients start to lose weight. Patients start to sleep better, less sleep apnea problems. And it's all from opening the bite or expanding the arch. And that's what we did with Rachel. She did have bicuspid extractions. And so adding volume and creating a less steep guidance really helped her to not only get lip support, but to feel like her bite felt better. And I think it's something that dentists don't talk about enough, the effects of removing teeth because of ortho to align them. But what are we seeing years later? Constriction, wear patterns, parafunctional habits, patients that are chewing through night guards. This is a huge issue. And I think we see it predominantly in those patients that have lost bicuspid. That's the number one key thing that I'm starting to say to them. Are you snoring at night? Does your significant other say you snore? And it's all constriction.
Yeah. And that's why I like to say that like the modern imaging tools that we have right now with CBCT and MRI of the skeleton and the joints, all of that gives us like almost like a crystal ball into being able to predict the future. You have that young patient and you want to see, can the skeleton support this treatment plan versus like letting it run its course. And then you have these adult patients that, like you said, have sleep disordered breathing. They may have jaw joint problems, clicking, popping, locking, maybe jaw pain, clenching, hypertrophied masseters. And they're asking you like, why didn't anyone figure this out? Right. And so that's where I get excited about the education piece of it is like, how can we intervene in our young patients so that we prevent some of these deficiencies happening later in life?
Absolutely. I think it's, you know what it is? And I'm sure when patients find you, they're like, oh my God, you've either made me an appliance or you've done something to make this situation better. But I think that so many patients in America live with these problems, right? Like they maybe are not lucky enough to find somebody like you or find a dentist that understands how much that can affect their quality of life. And I think I really, and you touched on something. I'm trying to remember. You were saying about, I lost my train of thought, but it'll come back to me. But I think what you're saying is so critically important to the success of case acceptance and actually executing these harder cases that don't need to be very hard if we understand what the prognosis is long term for the disease that we're treating. Absolutely. And a lot, oh, that's what it was. Facials. You were saying masseter tension. One of the biggest things that I see is facial asymmetry. So what I do is something known as facial aesthetic design. It's a very old school concept of designing the teeth so that they make the face look better. So what we look at is strong side versus weak side. So most patients have an asymmetric jawline where one side is hypertrophied, and you'll see it when they smile. Like on my jaw, this side is much bigger. My masseter is bigger on this side, and I have more wear on this side, right? You get it. And so what I see, and this is why I hate the fact that I can't share so much full face, but what I see is once I put the teeth in the right position and I hit the reset button, giving them better guidance, what I see is the jaws start to balance out. And I design the smile that sometimes on the weaker side, I'm actually building those teeth out more. So it creates better symmetry of the overall appearance of your smile and your face. And that's something nobody really talks about, of how teeth can make you look better facially. That's huge.
Yeah. And what we found, I'm just like thinking about my own self. When I had an MRI of my TM joints, I actually had 3 car accidents and I have dislocated discs on one side. And that's created this whole change in my bite. Like you said, like I'm breaking all my night guards on this side. I have more hypertrophy. And so there's been more like joint damage on that side. And that it's like the asymmetry kind of goes to that there's more condylar damage, more bone damage, more soft tissue damage. And I think that's what people don't realize is that the TM joints aren't always stable. And I think when we start to see that uncoupling of the anterior teeth and that shift to more of a class 2, we need to know that those joints are stable no matter what treatment you're proposing, whether it's clear retainers or big, beautiful smile transformation like what you're doing, is because you don't want to do this big case and then have their bite all of a sudden relapse or change in 9 months. And then they're like, breaking your beautiful ceramics.
Yeah. And you know when I see that more? I see that more in post Invisalign patients, right? They've done a course of orthodontics. Their teeth are still not stable, right? They've moved their teeth to do pre-restorative orthodontics. And we put these amazing veneers in. And what happens? The teeth can move in as little as a day. If they are not diligent about wearing retainers, and I want to say this, for life, that will affect the overall outcome of what happens at 1 year, 5 years, 10 years, 20 years, right? And these are like disclaimers that I feel like most dentists don't make to their patients. Like when I give them a retainer, I'm like, so if we're going to go through this process, this is what I expect from you moving forward. You need to wear a retainer or guard, specifically the first year. We need to make sure that your bite is stable. We need to make sure that you can understand these restorations, where they are, where the new positions are. And most patients have an easier time. I guess there's certain patients, and we can really get into this and be super nerds about this, but there are certain patients that you can open up and you can create amazing restorations and they'll never have an issue in their life. Like I had one patient who had such terrible wear on her teeth. She had tetracycline staining. So those teeth are a little bit of a harder tooth structure. It's a little bit harder to block the color, but I did her entire mouth. I did it in a very strong material. She's never, knock on wood, she's not chipped one in 6 years. Meanwhile, she was destroying her natural dentition. And so I think it's so important to educate your patients to why these types of restorations can help you. And 9 times out of 10, they don't require a lot of preparation. It's when we don't understand what we're trying to achieve that teeth become prepared. My job, and especially being 36 years old and being a younger dentist, right? Still being in dentistry for 10 years, but still considered a younger dentist, right? What I see now and what I talk about and what I promote is minimal preparation. And why do I say that? What are these restorations going to look like in 5 years, 10 years, 20 years, 30 years, 40 years, 50 years? Because I plan on being a dentist for a really long time, and I plan on redoing this dentistry when the time is right. Wherever you are in the world, you're going to come back to me and we're going to redo this. And what does that mean? It means that if I preserve as much tooth structure as possible, that means I will have more tooth structure when I redo this in that amount of time. And I think that's why I get so upset when I see patients going to Turkey and getting their teeth cut down and having all of these problems, because what they don't understand is that short-term gain of not spending a lot of money and getting something done in a foreign country can sometimes lead to a lifetime of dental problems. And that's the worst part, because now those dental problems, if I take on a case like that, become my problems. And the patient doesn't understand. And they say to me, like, why is this breaking? Or why is this happening? Why am I having these complications? Because you didn't do it right the first time. And you biologically had a price. What do you say to your patients that come in that maybe they've seen a different provider and they've had all this dentistry done, and then they're having all these joint problems? Because I'm sure you see a ton of them. What do you do in those situations?
Again, that's why I'm such an advocate for comprehensive exam, which includes all of that muscle palpation, looking at your clinical photos, looking at your scans of your bite, but also ear imaging. So CBCT for hard tissue, MRI sometimes for soft tissue, because also what we can find out from MRI is if that joint is in a state of active breakdown. So in that MRI sequence, we can do what's called a stir sequence. And if that condyle is lighting up like a bright white Christmas tree, it could be one condyle or both condyles. That could be a sign that joint is going through active breakdown. And so no matter what you do, whether you're giving them a sleep appliance or any type of orthotic or splint therapy or full mouth rehab, you need to advise the patient on whether their joints are stable for the proposed treatment, because it's not just the teeth and can the teeth handle the treatment, it's also can the skeleton handle the proposed treatment, and kind of that before and after as well. So I am such an advocate for modern imaging, modern technology. I think it's so exciting to see what we're able to do right now with 3D printing and VR, and just all the partnerships with like our colleagues on the medical side of just being able to see the anatomy. And I think our patients want that. They want to know that before they start their treatment. And so rather than coming from a place of an aftermath, I would rather be pro, like, okay, you want this big smile transformation. Can your skeleton and your body support that? And is that going to support your airway in the way that we want it to as well? So I think a lot of times it's like that interdisciplinary approach where you're bringing in maybe your oral surgeon or your periodontist or all of those things to get your best picture. But you have to know the picture before you start the journey, I guess.
I mean, my biggest thing is begin with the end in mind, right? Design what you want and then figure out how do you make it function, and not just function in the long term, in the short term, in the long term. How is this going to function? And I think one of the coolest things about working where I work is obviously Dr. Larry Rosenthal, Dr. Michael APA have been dentists forever, right? And what people do not see is the 30 plus year recall photos. I think the coolest part about what we do, and like, how can a dentist like me say this is going to last 20 years if I've only been practicing 10, right? But I can say that these techniques work because I see, and some of these pictures, it's amazing. Some of them are Polaroids. Like they took Polaroid photos of before and after. That's how important photos have always been to this practice and diagnosis and understanding facial aesthetics. And it's so amazing to see what this dentistry looks like at year 1, 2, 3, 4, 5, 6, 7, all the time. And the best part is seeing facial aging, this is really cool. So we'll have patients sometimes that Dr. Rosenthal did in the 90s come back and have their teeth done by Dr. APA. And then now have their teeth done by me. Now you have 3 different phases of life that you can talk about what they needed then, what they needed at this phase, and now at this phase. And that, to me, teaches you so much about how your restorations age, how facially you age. And I think that we have probably the most photos before and after of patients that have done this type of cosmetic dentistry than anywhere in the world. And I can say that. It is wild, the arsenal of information that we have. And now the better part is now we have more dentists. So now we can use all of that knowledge and teach this next generation of dentists to be great earlier on in their careers rather than being at the 10-year mark and getting great. Like we have some associates that are stellar dentists a couple years out of school. And you take that same person and you don't put them in our system, they're not going to be as successful. And so it tells me that what we're doing, not only to help our patients, but to also help elevate the next level of dentists. And I think that's something that I'm super passionate about. I know you're a teacher. I'm also a teacher. During COVID, I developed a company called Strive, and Strive was built by dentists for dentists. The goal is to create an arsenal of information that we can use to make the profession of dentistry better. Because I think why dentistry gets such a bad rep is everybody claims that they're a cosmetic dentist, right? But there's no such specialty as cosmetic dentistry, right? And so there are people that are out in the world, dentists that do this type of dentistry, but they have no formal training on it. And so then they have complications. And the people that have those complications are vocal about it. Don't get veneers, they just pop off. I've been a dentist for 10 years. Maybe I've had 1 veneer pop off. That to me doesn't make sense. It means that maybe there's a problem with your bonding protocol. Maybe there's a problem with your occlusion. Maybe your treatment plan doesn't address the true problem. And I think that's something I can say very honestly. When I was younger in dentistry, I wasn't as knowledgeable. So my treatment plans were not as good, right? So when people come to see us, I'll say to them, really, it's not 4 teeth. You can't do 4 teeth here. You can do 8, 10, 12, upper, lower, 20, all the teeth, but I would treatment plan less. And then I would have complications. Why did this tooth break? Because I didn't account for the fact that you had a deep bite and these teeth are a little longer than what they should be. And we're pushing the boundaries of what is possible. And so when you have complications, there's always a reason why, right? Is it the treatment plan? Is it the material? Is it the tooth structure? There's so many things that can go wrong in dentistry. And it's so funny because obviously the person that introduced us, Eric, he's a big biomimetic dentist. And the majority of our friendship when we're together in person, all we do is talk about teeth. It's borderline sickening, the two of us talking about bonding protocols and this and that, and talking about cases and showing each other cases because we're just super hungry for knowledge. And I think that's how you learn, is you learn from others and you try it and you test it out. And then hopefully you create your own protocols that are super successful. So interesting. I'm such a nerd.
So with Strive, I'm so curious. No, this is amazing. And with Strive, was that created were you able to actually cut back on like your clinical time, or is that like, how are you doing both of those things?
Yeah, I got a lot of grays. I
thought I'll start this educational platform and it's going to be amazing. And it's, you could have the best courses in the world. It doesn't mean that people will buy them.
Oh yeah, that's a whole thing. Let's talk about this actually, because you probably struggle the same way that I did. Strive was born during the pandemic when I was seeing the world come online, and there were so many educators on Instagram talking about dentistry, but you can't really talk about dentistry on Instagram with saying all the things that you actually want to say, talking about the patient and talking about all these compromised all the things that patients really should not hear, because it'll just create negative connotations around dentistry. And so we wanted to bring dentistry off of Instagram onto a platform that was more safe, like a safe space to talk about dentistry. And so in the beginning, we started just by having webinars, and we would have these events. We became AGD certified, so we were able to issue CE. That was a process in itself that took
months.
The amount of meeting minutes that I had to, it was insane, this whole process. But we did it, and then we would charge $5. We weren't charging to make money. We were just charging because we wanted people to show up. We had world-class educators. All of the educators that we had, they never asked for money. We would take that money and we would donate it. We would donate it to dental students. We would donate it to scholarships programs, to different programs that the speaker was affiliated with, because we didn't want to make money. Money is such a weird thing for me. I don't want to make money. I just want to create amazing things that exist in the universe. And I know that sounds so insane, but if you build things that you're passionate about, the money will always come. I'm not worried about creating this so that I can make X dollars. I always just wanted to create things that never existed. And so when the world came back online and they weren't doing as much webinar stuff, I started to think there's still a need for a masterclass of this type of dentistry. So I created an online masterclass. It's called Details, and it's 6 hours of me talking about dentistry and showing cases and talking about cosmetic dentistry. And that then turned into an in-person 2-day hands-on course. And I remember the first time we created this course, I was putting it online, and me and Dr. Rodri Thomas, who is my business partner, and he's an amazing human being. He's a friend of mine for many years. I remember putting it online and being like, you think anybody's going to buy this? Do you think anybody's going to show up? And it sold out relatively quickly, but not as quickly as I would like, obviously, right? I wanted it to sell out so fast, right? But it didn't. It took a little bit. And now we're at this point where we're 3 years later, and I'm getting 15 to 20 emails a day. When are you releasing new dates? When are you doing the next course? What are you creating? What are you working on? And it's such I don't take it for granted. It's such an amazing thing to be able to put a course up and it sell out. And with 2025, we're thinking about, we're adding locations and we're taking this on the road, and it's been so amazing. But my team gave me this stat this week that we have had 368 dentists from all over the world, from 6 different countries, an exuberant amount of different states, come to our courses. And that is in a very short period of time. And it's super special because it's just something I absolutely love doing. Honestly, more sometimes than even doing the dentistry. But I'm of the mindset that you can't be an educator and not be a practitioner. You have to be both. And if you're not both, that's where people get up on stages and they're talking about this idea of dentistry that just is not feasible to execute. I am a real world practitioner. I practice 4 days a week in Los Angeles. I travel Friday, Saturday, Sunday to teach all over the world. And I don't know exactly how I do it all, but it all gets done. And yeah. I just hope that when I'm done from this world, I hope that what I'm creating has hopefully impacted thousands of people. And it hopefully will become hundreds of thousands of people, because if I teach a dentist how to do something and then they go back and serve their population of people, that to me is exponential, and how many people it can really influence. Yeah. And don't you feel the same when you teach? Doesn't it feel so rewarding to see people out in the world that are doing things differently because you taught them something like that? When I see my students posting smile makeovers, I'm so excited. It makes me just want to feel like I got to do more. I got to help more people. It's a lot.
Yeah, no, and that's been like the evolution of TMD Collective too, was just like seeing my patients suffer from jaw joint problems and seeing like, why didn't anyone understand this, or why didn't they diagnose it correctly? That's where it was like, in order to make it better for the individual patient, we have to make it better for the collective. And I think as women, we were sometimes treated in healthcare like we're like a brushed off, or so many times patients are like, people told me the pain was in my head, or it wasn't real, or I needed cognitive behavioral therapy. And so that gets me going. It's like, same thing. I want to, it wasn't really about the money, although it does take money to run a business and to do some of these events, but it was more about changing the trajectory of the next generation and giving these new dentists these tools and skills to be able to diagnose their patient. And like I said, see if the skeleton can support their treatment plan.
Yeah.
So
when we really think about it, what are they really teaching in dentistry when it comes to occlusion? They're teaching conformative dentistry, right? Come in, do one posterior crown, adjust your bite, and that's it, right? They're not teaching comprehensive dentistry the way that we do it when we're evaluating airways. Now, they try, but how can you do that? All of the things you need to do to teach a dentist to be a dentist in 4 years, give them the experience that they need. It takes so much time. I remember, this is so funny. I saw John Coys in my 3rd year of dental school, lecture at NYU, and he was amazing as a lecturer, like one of the best lecturers I've ever listened to, because he's not like very up and down. He's very monotone, but he makes his points and he's really direct with what his message is, right? And the interesting thing about that is about 10 minutes into his lecture, and I'm a 3rd year dental student, and he's talking about constriction. And I'm like, what is constriction? I've never heard that word before. 10 minutes into the lecture, I didn't understand anything else he was teaching. And so I made it my mission right then and there to say, you know what? If I don't understand this type of dentistry, how can I do what I want to do, which is cosmetics? Like, I need to understand this. So in my residency, I made $32,000 after taxes in my residency year. And I took 12 of it to go see John Coys and to learn. Yeah. I went to Seattle. I was so poor. I was eating cup of noodles like most days because all of my money was going towards Coys. And so I remember getting there and being so excited to learn. And I'm in my residency year, and my residency director actually said to me, like, I don't know why you're doing this, why you're spending so much money. Like, you're not going to understand anything. And I'm like,
who says that?
I don't believe that's the case. I think I'm going to learn a ton. And I think it's such a closed-minded thing to say that. Like, I want to better myself. Why would you? Anyway, men, whatever. It's a men thing. Maybe it's an ego thing that he didn't get that opportunity. So I went there and I learned so much. And I had an amazing Coys mentor, and I learned from John. John's a kid from Brooklyn also. Like, I loved learning from him. And it really changed my direction to understand that if I want to do this type of dentistry, I need to understand so many things in dentistry, not just the cosmetic aspect, but the orthodontic, the periodontic. How can we evaluate? And one of the biggest things that he said, and I still repeat it back to patients, he said in one of his first lectures to us, you are supposed to wear the thickness of a piece of paper every 20 years. And so when a patient comes in and they've worn a stack of papers and they're 25 or 26 years old, you know that there's a problem. And so that was something that really opened my eyes. And then he started talking about wellness scans, right? Scanning a patient at year 1 when they come into your practice, scanning them at year 5, and having a real conversation with them and saying, when you came to see us, this is what your teeth look like. You are grinding. There's a reason for it. We're going to have to understand this. Let's treat you in a holistic way that addresses the problem. And he started talking about how he treatment plans cases and how can we not compromise the end result And we can do cases where we mix materials, where we do porcelain anteriorly, and then we maybe do milled composite onlays, and we bond and we open the bite. We don't diminish the treatment plan. We execute the treatment plan, but we do it in a way that the patient can afford. And then once we have set them up, we can go back later and convert over cosmetic composite to porcelain quadrant by quadrant. And that was the first time I really started to think, I can't treat my patients with just the one problem that they're coming in with. I have to be holistic in my plan to them. And if I am, it's going to create more predictability long term. And it's something I talk about a lot when I teach, because so many of these younger doctors come to listen to me. So many of these, and we have to talk about this, female doctors come. My course it's wild. It's 30 women and 5 men. And they all look at me as like this female goddess, like I'm doing something amazing in dentistry, but they can all do this too. Every woman can do this. It's just about never accepting no for an answer. That's the first thing. And then just really understanding that there are ways to go about gaining information and knowledge that others can't. And as a woman, we have this innate nature to be a little more sensitive and understand emotion. And I think my patients come to me because I am a woman. And I think that they understand that does change the experience. And I think there are so many women out there that are maybe in a situation where they have a male mentor, or they have somebody that is a man that oversees them, and they feel so restricted. And I think you have to be so strategic. And I was telling you about this before we jumped on. I am a strong personality. I am an Aries. I'm a year of the dragon. I am a dominant woman from Brooklyn, New York. And I am not afraid to voice my opinion. And I feel like sometimes, and maybe this is just my own feeling, but I feel sometimes when I talk, I'm perceived as this like aggressive woman, right? But if I was a man saying the same thing, people would just say, oh, he's a man. It's not such a double-edged thing. It used to happen to me all the time. Tell me if you've ever gotten this. So I would go into rooms to see Dr. Appa's or Dr. Rosenthal's patients, and they would be like, oh, let's get the photographer in here. God forbid I would be a dentist, right? My coat says Dr. Andi on it. And they were like, oh yeah, I thought you were just a photographer. And I'm like, no, I'm a dentist. Yes, I'm Dr. Andi. But I never let it bother me. I just would say, okay, not an issue. But when it would really matter, it would be funny, because especially earlier on when I would see patients for emergencies that weren't my patients, and I would see them on holiday weekends or on Fridays when the other docs were not in, and they would say, I want to see Dr. So-and-so. And I'd be like, Dr. So-and-so is not here. I'm here today. I'm going to help you if you allow me to. And I make them have this amazing experience, right? And now I've converted them. I always looked at it as a challenge. If I can get you to say that you had a great experience in my hands, I'm an extension of these two people that I work for. And I'm going to make sure that I treat you to the best of my ability. And it doesn't matter if I'm a woman or a man when I do that. It's so frustrating sometimes. And I get it. I get why people feel certain ways, like why women are slighted in dentistry or in any medical profession or in any profession, period. To say that there's not a double standard is mind-blowing to me. There clearly is one in dentistry. Do you get a lot of that as well?
And that's partly why I started. I think I told you I have my first big event coming up in a week from tomorrow. So it's my Interdisciplinary Perspectives Uniting Women in Dentistry. It's a bougie event that I'm having here where we're going to have wine tasting, private shopping event, Pilates. It's more of a retreat, which I want to talk about your retreat too. But part of why I wanted to start it was because I've been in other groups where it was like, oh, you're not worthy of the stage, or I can't think of a single woman that's like worthy to come to this thing and speak, or other women being talked over, where just like that person is brilliant, and you're going to have a man talk over her. I'm like, this is not happening. I'm going to start my own thing.
I'm glad.
I know you're doing your own thing. And I just think not everybody is like that, but that fuels some of the passion of like where I want to come in and start new educational platforms where we do support other women and we are collaborative and we're not scared to ask questions because we're not going to be like humiliated or cut down in the middle of a lecture hall.
Oh my God, that resonates with me so much. Well, first of all, I'm so upset that I can't be at your retreat. I actually, after I told you I think I'm away, I went back and I was like, you know what? I don't know, like, where am I? I have a lot of travel coming up. I was like, maybe I'll just show up. If I can hop on a flight, I might. You never know. I'm a little crazy like that. But I fully love that. And I support what you're doing because it has happened to me countless times. I remember, and I'm not going to like name names of who this person was, but I was taking a course with Dr. Christian Coachman, and he is amazing. I love him as a person. And it was hosted in this other dentist's office. And it was a 2-day course, and I was maybe a year out, and I was working at APA Aesthetic. And I remember I asked a question, and I just asked it because I didn't understand. I was taught this, and they're saying this, and I was like asking a question because I'm at a course that I've paid money to learn, and it wasn't Christian, but it was somebody else that basically said to me, I don't know what they do at APA Aesthetic, but this is what we do everywhere else in the world. And I was just asking what burr you use. I'm so confused. And at the end of the course, I remember sitting there talking to Christian. I'm like, I had known him for many years. He was a speaker at NYU for years. And I remember talking to him, and this dentist comes up to me and he says, you should really be more humble. And I looked at him. And I didn't say anything because I try very hard to be very humble about everything I do and every opportunity I've ever had in my life. Most people don't know the real Andi of all the fucking shit that I've been through in my life and all the people that I've lost and how I've fought through all of that to get to where I am today. And Christian turns to that doc and he goes, I don't think Dr. Andi. She's one of the most humble human beings you'll ever meet. And maybe you just got a different perception of her. And that was the first time I ever felt like, I can't believe that somebody thinks this about me because I'm affiliated with APA Aesthetic, or thinks this about me because I'm a woman, or asking questions because I'm hungry for knowledge. And I'm telling you, I know it happens on the lecture circuit because it's happened to me. I remember speaking last year at an amazing event. I was after a certain lecturer, and I remember he got off stage and then he decided that he was going to have a Q&A session in the front of my lecture and talking loudly. No. And it broke my concentration to feel like, okay, I'll just wait till he's done. And it cut into my time and I wasn't able to give my message. And I feel like it just happens and it's just brushed off. And I'm not the most sensitive woman, but I also just feel like in this world that is so dominated by men and ego, there is so much room for all of us that it shouldn't be an ego thing. There's so much room for so many patients to come and be treated by me and be treated by all of you. And I've always had this abundance mindset where I'm not gatekeeping. If you message me and you have a question about something I'm doing or something I'm talking about, I'm going to send you a voice memo back. Ask half of Instagram because they get voice memos back from me. Because I want to build something so great without any limitations. So yeah,
and you're so generous with your knowledge too, and that you exude that generosity. And I think that's partly why people are so drawn to you, because they see that, they feel it, they sense it, and they want to learn from you. And that's the kind of mentor that people are they're flocking to because they sense that. And I think when you're real like that, and I tend to like wear my emotions on my sleeve and be a little too raw, too real sometimes too. But I think when you're authentic empathetic and you're generous and you don't put people down, and you just feel like there's enough pieces of the pie for everybody. If I'm not your thing, it's okay. But I think people sense that.
I hope so. I hope so.
I think that's why I was drawn to you. I was like, I have to have her on the podcast. And I want to hear, you're going to be a speaker at the Making of, and that's in September. Because this episode's going to drop 9/9, but I think in a couple weeks you're going to be going to Vail, Colorado. Is that right?
Yeah. The interesting thing about being in dentistry is I still remember the first time somebody ever asked me to speak, and I had 10 hours of lecture already prepared because I always wanted to teach, but I never was given the platform to be able to do so. And so I met Ashley, who is the founder of the Making of, and she has 2 amazing clinics, and she has this mastermind group. And just like you, like, she reached out to me and she's like, hey, like, can we do this? Like, can we do a podcast? And I'm like, oh my God, I freaking love you. I'm obsessed with you. And so she invited me to come lecture last year. And it was such a different type of dental event, like your event, like not just dental, but like building these real connections with people. And we're not talking about dentistry per se, but we're talking about building a business. So this year, this is going to be the first time that I've ever done a lecture where it's not at all about dentistry. It's about the journey and the trials and tribulations of building a business. And that business is Strive. Strive has grown so much in the last few years that it has changed who I am, and it has created this amazing flow of income, but it also is my outlet to be creative. So I'm going to be in Vail, and we're going to talk about all of that journey. And it's funny because last year I spoke at the same conference, and it was right before I moved to LA. So 1 year later, I'm a completely different human being here. And that journey has led to so much introspection of who am I? Who is Andi? Because I think so often I was in the shadow of Dr. Larry Rosenthal, Dr. Michael APA. Now it's Dr. Andi-Jean Miro. And I'm not afraid to say that anymore. I am a completely different person than I was the last 10 years of my life. And it's because I'm finally happy in what I'm doing and what I'm creating. And that's what I hope to share at the Making of. So hopefully we'll see some of your podcast listeners there for sure.
Yes. Yes. Yeah. And it's going to be bougie. It's going to be at the Four Seasons. It's going to have all of those great activities. And for sure, we're going to put that information for our listeners in the show notes. And Dr. Andi, I'm just so honored to be able to talk with you and have you on the podcast. I feel connected with you. If you decide to hop on a plane, come up to Seattle, Tacoma is just like a short 20-minute ride south of SeaTac. Our hotel's right on the ocean.
Listen, if I make it amazing, I definitely will try. If I don't, we still have to meet in real life. So I'd love to have you join us at the course on me. Just be a part of it. Any course date next year in 2025, you're going to come be a part of it with us, and maybe you can talk. And I'd love for you to stand up and talk a little bit about TMD, your collective, because that's what this world is about. It's about us raising each other up. And I just want to say thank you for having me on. Thank you for letting me share some of my life. I feel like people always want to know more about me because I'm so private and intentional with what I share. But I'm thankful to be able to do it on a platform like this. So it was so good talking to you, and we're going to connect after this. And now we're friends. We're real friends now, not just Insta friends. I love it.
I love it. And like I said, maybe 2025, we've got to carve out this thing that it's lifting all these women in dentistry up and bringing all of us together, because we need that for sure.
I'm there. We got to get Ashley there. We got to do this. I'm excited. I think we should do something together, both of our programs, and we should do something and collaborate, because that's when the coolest stuff starts to happen.
Let's do it. I love that.
I love it.
All right. Thank you so much. My little sign off is always stay humble, stay curious, and thanks for listening to Jaw Talk.